Right again, you're welcome to my channel. This is your friend Nurse Pollution. We want to talk about sex after childbirth, and this can be a very, very sensitive topic, and it's very emotional. You understand when you see what women go through during pregnancy, delivery, and of course they are still having problems postpartum period. So understand. So what are the things to consider before having sex postpartum period? Number one, you have physical consideration. Healing time usually is supposed to be between 6 to 8 weeks for vaginal tearing or episiotomy or something. Then, of course, most of the time, we women experience vaginal dryness, hormonal changes, breastfeeding problems, and all that. And of course, at times that might be painful. The breast might be tender and painful. And of course, at times we have painful intercourse, but most of the time it might just be temporary, because if there is proper healing, it might actually go away with time due to vaginal stretching or trauma of the baby head coming out. Then at times we will have weak pelvic floor muscles, which with little Kegel exercises, that's pelvic exercises, it can be fixed. Then number two, another consideration is emotional consideration. At times you see there are a lot of body changes. Maybe you were like this and you are now bloating up. If you are too conscious about your body, and you have insecurity about your body, is one of the things that you might consider that might give us stress postpartum period. Then emotional fluctuation, like some people have postpartum depression, some people have mood swing, decreased libido, they have appetite to sex, and all that. Some have problem adapting or adjusting to motherhood. So it's just left for the partner to be able to, be there for them, to help them navigate this period and time. Then you have to prioritize caring for the child also. Not only the sex is something, but we have to prioritize how do we care for this child. Then there should be relationship dynamics like communication, intimacy, not only sex. You can do physical organ, emotional talks and all that. Then you should wait for your doctor to give you a medical clearance, like a certificate after 6 to 8 weeks that you can start having sex. And you have to start with gentle non-penetrative intimacy like kissing, touching, romancing, and all that. And if you're going to go deep, you should use water-based lubricant like KY jelly. You have to explore various position of comfort. You have to know what is good for you now, and you have to communicate openly with your partner. Let them know what you're going through. They are not in your heart or your mind to know what you're going through except you speak up. It is better for you to speak up. Prioritize emotional connection this time around, not only the physical penetration. And what are the common concerns during this time? Number one, we have something we call dyspareunia. That is painful intercourse. At times you have feelings like vaginal muscles are loose or relaxed. They are relaxed and you are afraid. Maybe your partner might not be able to enjoy sex. Those are some of the things. That you have decreased libido and difficulty achieving orgasm. Is just going to be momentary, is going to still go. So what are the natural remedies that we can use? Number one is Kegel exercises. Like we have said, there is pelvic muscle floor exercises. If you talk to your doctor or your physical therapist, they'll be able to show you how to do it. Pelvic floor physical therapy is very, very important. You have to balance your hormone with a lot of herbs like maca, like fenugreek and all that. Then aromatherapy like clary, sage, or even a whole lot of things like that. And of course, if you want to do the medical options, you can see your doctor. They can give you something like vaginal estrogen creams, hormone replacement therapy, vaginal rejuvenation, of course, pain relief medication. And if there's anyone, your midwife should be able to take care of that. Remember, it is very important here to prioritize your emotional connection over physical sex. That's intimacy, not the sex. Then you have to communicate openly with your partner. Just be sincere with them. Let them know what you are going through and focus on pleasure and not only the performance. You have to focus on pleasure and not only the performance. Bye for now.